I'm here with Dr. Sieffert. We're bringing a message to our patients about the recent Allergan BioCell textured implant recall. The first and most important point is that for all current patients of our practice, all past patients for whom we've done operations, we've never used the textured silicone or saline implants. We've always used smooth, round implants. So that really doesn't affect current patients. It could potentially affect patients who are interested in seeing us because they detect a problem. If that's the case, then we'll come in and have a conversation.
So this recall applies to Allergan BioCell textured breast implants. The BioCell texturing is a proprietary technology that Allergan uses to place stippling on the surface of the implant to help it sort of ingrow into the tissues so that shaped implants don't rotate inside the body. So this doesn't apply to smooth implants that Allergan has made and any other manufacturer's textured implants. These products were recalled because of the concerns for breast implant-associated ALCL, or anaplastic large cell lymphoma. It's an incredibly rare disease with only about 280 cases reported in the United States and about 480 reported worldwide. That means about 1 in 30,000 people who have textured breast implants are affected. So breast implant-associated ALCL tends to present about 6 to 8 years after placement of the implant, and it presents as either painful or painless enlargement of one or both breasts, and can be also associated with masses and other nipple changes. Treatment of breast implant-associated ALCL, especially if caught early, is removal of the entire capsule and the implant, and the effect of removing it is effectively completely removing the lymphoma.
This is a very treatable condition when it's diagnosed and treated early. So anyone who has a potential concern about this should come and see us. We may recommend a simple ultrasound, and we can go from there. So don't delay if that's the case. Otherwise, if you are a current patient of ours, just keep in mind, first and foremost, this is not a condition that would affect you.
So what are we recommending for patients who maybe have textured implants but are not having symptoms or concerns?
Yeah, so I think the issue here is, what is the risk of developing something like implant-associated lymphoma versus what are the potential risks from undergoing an operation? The risks are the same as they would be in an initial operation: bleeding, infection, changes in nipple sensation. So we don't take the risks lightly of going in to operate, particularly because the incidence overall of this lymphoma is so rare. So the current recommendation of the American Society of Plastic Surgeons, the American Society of Aesthetic Plastic Surgery, is to leave the implants in place unless there is a problem that's diagnosed through ultrasound or on exam. There are some patients who, despite that, are very concerned, and certainly it is an option to go back and remove the implant and the scar tissue prophylactically, and that's a decision we could discuss further in detail.
Certainly. If you do have concerns, please come have a conversation with us.